Today's topic is anxiolytic and hypnotic drugs, uh, these drugs are used for the treating of the insomnia and also to reduce the anxiety. And the most common group among these drugs is benzodiazepines, because benzodiazepines are the safest drugs for the treatment of these diseases. And during the last 25 years, they virtually replaced the barbiturates that have been mainstream of the treatment of the anxiety and insomnia about 50 years ago. And benzodiazepines include many drugs, and some of them are used as sleeping agents for the treatment of insomnia, and that includes lorazepam, long-acting, midazolam, intermediate acting, and also temazolone, and triazolam is short-acting drugs for the insomnia. Other benzodiazepines like the clonazepam has higher anticonvulsant activity and used for the treatment of the convulsions, and also the diazepam is the same indication, and other benzodiazepines can be used as anxiolytic, and that includes chlordiazepoxide, diazepam, and flurazepam, and also some sleeping like lorazepam sometimes as well. So together benzodiazepines have anxiolytic, hypnotic, anticonvulsant, and myorelaxant effects, and all these effects are used for the treatment of diseases, and also some of them have some effect to the memory, and sometimes can lead to the reversible loss of memory, but not all and not all benzodiazepines will have this effect, and not in all types of the patients. And the other group is barbiturates. Barbiturates are seldom used in the modern medicine, and the phenobarbital is still used as anticonvulsant medicine for the treatment of children mostly. Sorry, phenobarbital, not pentobarbital. So phenobarbital, and tiopental is sometimes used for the general anesthesia, but tiopental is not approved for in Russia, so it's not used in Russia but used in other countries like Germany and other Europe, and also in the US. And pentobarbital and sacubitril are the derivative of the phenobarbital with the longer acting drugs. So and barbiturates have the same mechanisms of action as the benzodiazepines, and these groups will interfere with the GABA receptor. So normally GABA receptor is inhibiting a receptor, and gamma aminobutyric acids will activate the receptor, that will lead to the opening of the chlorine channel, and chlorine ions will go through the channel and lead to the decrease in the polarization of the membrane. So because chlorine are negative charge and they decrease the potential of the membrane, so the neuron will be harder to excitate, so that is why that will lead to the inhibition of uh, the firing of the neurons. So, and benzodiazepines increase the affinity of the GABA to the GABA receptor, and that will eventually lead to the more chlorine channels opening, and more chlorine will enter the cell and inhibit the cell, so will hyperpolarize the cell, that prevents the firing of the neuron, and making the action potential of the neuron that will decrease the activity of the neurons, and that will lead to the inhibition. So this is the primary mechanism of action for the most for the most anxiolytic and hypnotic drugs, including benzodiazepines, barbiturates, and some other hypnotic agents like zaleplon and zolpidem. So these two are the also activating benzodiazepine receptors, but they have a non-benzodiazepine chemical structure. So also some other drugs that don't have an GABA activity can be used for as a sleeping agents. That includes antihistamines, and first generation antihistamines have adverse effects. They lead to the sedation. That is because of the anticholinergic activity of these drugs, and that includes diphenhydramine, that is trade name is Dimedrol, and also suprastin and other brands, trade names, brands that are very commonly used, and most of them are over the counter. Then also Rimelteon is the new drug that is acting on the receptors that induce the sleep, and to the melatonin receptors, and this is one of the newest drugs with less influence to the sleep quality. And because all other drugs like benzodiazepines, barbiturates, and most of the traditional sleeping agents will decrease the quality of sleep, that means they will decrease the fast stage, and that will make the patient to feel insomnia, even if he or she slept well during all the night, but still feel sleepy because of the lack of the fast sleep. So you probably know that the sleep is divided to the two phases, fast sleep and slow sleep. So during the fast sleep, people see dreams, and the brain activity is slightly increased, and this is the most important part of the sleep, and it's very important to have several phases of this fast sleep to make sure that the person is sleeping well and don't feel sleepiness after waking up. And then there is a slow sleep, during the slow phase, the patient has less brain activity, and there are no any dreams, and also no movement of the eyes, no movement of the body. So it's like a normal resting state. So both phases are required, and they should change each other several times during the night. So that is crucial for the sleeping and resting after the hard work or hard study. So that is why sleeping disorders are very important for the people, and many people are complaining for the sleep diseases, and sometimes these diseases can not be diseases at all, so they don't require pharmacological treatment. So, and first of all, sleep disorders should be assessed with the uh, increasing the uh, so making the environment more friendly for the sleeping. For example, if the patient sleeping in a noisy room, then the room should be changed, or some noise suppression activities should be done. Then some people may afraid of the darkness, so then special lighting can be used. Then some people may vice versa require a darker room, so less light should be used, or curtains should be used uh, to close the windows, so the sun at the morning will not make them wake up early. And also uh, the quality of the bed, then the pillow types should be comfortable, so everything should be comfortable for the sleeping, and no one should disturb person during the sleep. And if these all conditions meet, and also if most of the time some other diseases can disturb the sleeping, like for example depression, and if some there are some reasons for not sleeping, they should be removed to make sure that uh, all conditions are met for the sleeping. So also for people, sometimes the exercise that is exercise before the sleep, or the walking or outside, can be recommended to to increase the tiredness, and usually tiredness can help to fall asleep. So, and if all these measures are not helping to fall asleep, and patient still has insomnia, only then, and only then the uh, pharmacological treatments should be considered, because most of the sleeping agents can lead to the uh, dependence, and usually uh, the treatment will fail if the conditions for the sleeping are not met. So that is why uh, the some psychiatric uh, treatments may be also required simultaneously to resolve the issue. So that is why patients should not only use the sleeping tablet, because this is easy way, but unfortunately long administration can lead to the dependence, and the treatment of the dependence is even more complex, and also more expensive. So that is why recommended duration is no more than 2 weeks for the benzodiazepines, uh, and longer duration only can be approved by the physician. So that is uh, has a much knowledge about the much practice about the treatment of the sleeping disorders. and that is usually a neurologist. So specialists should be consulted before administration of any of these agents. And usually the dependence is more severe with the short-acting drugs like triazolam, and is less prominent with the long-acting lorazepam. So that is why, especially in the elderly, the long-acting drugs are recommended. And also, like there are two types of the sleeping disorders. Like first type is when the patient cannot fall asleep, and this is most common in young patients. And in these patients, short-acting and intermediate-acting drugs should be prescribed to help them fall asleep, and usually they don't have problem with the early wake up. But with the elderly patients, it's more common to have a problem with the early waking up because they easily can fall asleep but usually wake up at the morning, and that leads to the short duration of sleep. And to treat these disorders, they should they should use a long-acting sleeping agents, because they take it before bedtime. So sleeping agents are always taken before bedtime, and they should still be active at the morning. And that is why long duration of action drugs are required for those patients. So, and usually this is elderly, but can also be seen in some young patients. But young patients usually cannot fall asleep because of the work issues, or because of the relationship issues, or some other issues. They think about these issues, and that is why that prevents them from falling asleep. So, and for the and some drugs can also induce insomnia. So, and drugs of abuse, for example, may lead to the agitation and increasing activity. So that can lead to the insomnia. And also some activities can increase insomnia, or food even can increase insomnia. So for example, it's not recommended to drink a coffee at the evening. So like so your last cup of the coffee or tea should be at 2 p.m. and earlier. And or if you like the taste of the coffee, then it's encouraged to order a decaffeinated coffee and decaffeinated tea at the evening, so that helps to fall asleep at night as well. So, and of course, no coffee before the sleep, and also before no tea, or other central nervous system stimulants before the tea. And also, for those of you who are a fan of the uh, like some activities, like for example movies, scary movies are not recommended before sleep as well, especially for the children. So because children can have dreams that can make them wake up, and they will be very scary, and cannot fall asleep afterwards. Or some thoughts about the uh, the scary things can prevent them fall asleep, and usually, especially if the children sleep alone, so they commonly fail to fall asleep. So so this all this actually is important. So also for the before the prescribing the drug and dispensing the drug, make sure that person is not driving, because all of the sleeping agents will lead to the sleepiness during the day, and that may be a problem with those who is driving, and also for those professions that require attention, like train drivers, the building, construction builders, construction workers, like pilots, etc., etc. So although pilots usually have special places to sleep and they can replace each other, like there are always two pilots at the plane, but still it's not recommended to prescribe a sleeping agent for these professions. So in case of the overdose, there is an antagonist of benzodiazepine receptors, flumazenil. Flumazenil can be used for the reversing of the action of the drug in case of the overdose and intoxication with the benzodiazepines. It is the most common reason for this overdose is suicide attempts. So because benzodiazepines are considered sleeping agents, and in like 50 years ago, barbiturates were the only drugs available and were commonly used for the suicide, because even small overdose could easily lead to the death. But with the benzodiazepines, it's not the case, and usually requires 1,000 times overdose to be able to suicide. But it's not actually possible to eat those a large amount of the tablets all at once, so that is why, and they are also prescription only, so that is why uh, it's very hard to overdose with the barbiturates, but it's very hard to suicide, but overdose can be seen, so the flumazenil can be used for the treatment of the overdose. It's very effective and also uh, fast-acting antidote. So people still try to suicide with the sleeping agent, but they don't know that these are different sleeping agents, so they are more safe than barbiturates. And this is one of the reasons they switch from the barbiturates to the benzodiazepines, because they are safer and also less adverse effects and less addiction. So that is why benzodiazepines replace the barbiturates very fast, and because of the safety and also the effectiveness, and the less dependence, slower dependence, and easier to treat the dependence. So these are the better drugs by anyway. So that is it for today, and thank you for your attention. And if you have any questions or comments, feel free to leave them below.